let's say about 6 months ago, she started having pain on the outside of her ankle around her peroneal tendon. So she went to
Can
see a
you show
podiatrist.
people on your model where that
Yeah,
is for our lay
right
people?
here
Mm-hmm.
on the peroneal tendons. And then she was placed into a boot, like a cam walker boot to walk. So for 6 weeks. And then after that, I forgot if she did physical therapy or not. It was with somebody else. So then she got better, but then she still had some lingering pain. Not, terrible, but there was still something there. And then come to like 6 weeks before she saw me for the first time, she's walking and then she's just like kind of in a pothole. She walks in a pothole and then, she twisted her foot and she felt a pop. And then she went to urgent care because she's concerned. She felt a pop and then she has a lot of pain. And then urgent care takes some x-ray, chick, chick, chick. Everything is fine. There's no fractures. And then she just goes with her day. And then she's just like, okay, it's gonna take some time to heal. And after 6 weeks, still hurting her. So then she calls the office, she comes in, and then in my case, just hearing her story, seeing her foot, right away I knew what happened. And then she completely ruptured her peroneous longus tendon. So there's two peroneal tendons. There's the I'm sorry, my model, like the tibia is at the wrong spot.
That's all right.
So basically there's two peroneal tendon. There's a longus that goes on the bottom of the cuboid and then attached at the base of the first metatarsal. And then there's the brevis that comes here and then attached to the base of the fifth metatarsal. And then when it curves underneath here, there's some people that in the tendon itself, there's a bone just to kind of decrease the friction so that to protect the tendon. And then that's called the os peroneum. In her case, she broke it. So like, and then it's within the tendon. So if this is broken, it means that the tendon is completely ruptured. And then just looking at her foot, she had a huge bump on the side there because that bone had retracted up to here. So that I took an X-ray and I looked at the X-ray from urgent care, and I could see right away. There's like, here there's like a little bit of remnant of bone, and then over there there's like that big piece of bone that's there. Then I took another X-ray just to make sure it didn't retract or anything, which it didn't because there's some structures here that prevent it to retract more at the peroneal tubercle. But I told her right away, I'm like, you tore your peroneus longus tendon, and then we're probably gonna have to do surgery. So then I did an MRI, and then of course, it was ruptured. And then in her case, it's not just that. So yes, she had an acute injury, but then also she had an injury before, right? It was kind of chronic, like acute on chronic, right? So, and then looking at her foot, she has a high arch foot. So basically, when she's standing up, instead of having like a foot that's, a little straighter, her foot is, I'm going to exaggerate it, but like her foot is kind of like twisted this way. So if you picture those tendons that are coming this way, they're just always under tension. And then in her case, if I went there and then I just fixed the tendon without fixing the shape of the foot, well, there's a chance that it's going to come back again. So what we did, I went in and then it's called a Dwyer. But so basically it's just cutting the heel bone here, removing a little wedge, kind of like close and then like decrease the arch, like decrease the cavus foot, the high arch foot a little bit. And then also like take this portion, the heel bone, just move it a little bit to the side there so that it balances the force a little bit more, it decreases the strength on those tendons. And then in her case, when I did the surgery, that was 2 weeks ago, her peroneus brevis also had a longitudinal tear as well. So I'm glad we did something because, now it would be just like one tendon